is Dr. Upneet Chawla. Thank you so much, Rebecca, for the kind intro. As you can see here, I've already made one mistake. It is not March 29th. I also did this when I was a little sleepy. As Rebecca had mentioned, I am double board certified in internal medicine and sleep medicine. So currently I'm on a hospital shift where I work through the weekend, and I was working on this presentation after a 12-hour shift. So I was a little bit low on sleep, and as we have learned already, that low sleep can cause minor or also some major mistakes. And again, I just want to say thank you so much for having me. It truly is my passion to educate the masses on sleep. Oftentimes I get asked to speak, from medical students or residents. So this opportunity is extra special for me because it's kind of a different audience. And so, I'm very excited to share my knowledge on sleep. And at the end, we can do a little bit of Q&A so that you could learn a little more on sleep too. So without further ado, how much sleep do you need to solve a murder? All right, so I guess it depends how old you are. As pictured here, the American Academy of Sleep recommends that you get these numbers throughout different stages of life. Babies require a lot more sleep, 12 to 16 hours. If any of you have children, I'm sure that you know that already. And this is to function at optimal health. And then as we age, that requirement decreases. So 11 to 14 hours for toddlers, 10 to 13 hours for kiddos, 9 to 12 for a little bit older kiddos, and then 8 to 10 in your teenage years, and then 7 to 9 is really recommended for young adult and onwards. All right, so raise your hand if you've heard any of these before. Right, sleep is for the weak, and kind of similar to our movie, you can sleep when you're dead. Maybe it was a friend trying to convince you to go out with them for the night, I don't know, or maybe a work colleague trying to encourage you to, work all night. I think in this day and age, it's starting to change, but I remember a time when it used to be cool to not sleep. Like in this little cartoon right here, there's one claiming he slept so little, and then the other one is bragging about he didn't even sleep at all. And I'll be honest, I myself did this in medical school. It was quite the feat to pull an all-nighter. It was very cool, to not sleep. It was all about hustle culture, to work while everyone else is asleep and sacrificing sleep to get ahead. But the fact of the matter really is that we need sleep. Sleep is crucial for our health, and bragging about an unhealthy lifestyle may feel good for the moment, but it will ultimately lead to greater consequences. So according to the National Center on Sleep Disorders research, about 50 to 70 million Americans have sleep disorders, and 1 in 3 adults do not regularly get the recommended amount of uninterrupted sleep. Let's take a vote. Raise your hand if you get 7 to 9 hours of sleep. I feel like everyone here is young adult or older, so okay, so nobody. Okay, some people. Okay, there's a few people, but I would like to see that change, and maybe after tonight it will. So there's tons of sleep disorders actually, but tonight we're going to focus on insomnia. So what is insomnia? Insomnia is difficulty with sleep, whether that is falling asleep or staying asleep. Acute insomnia is when the symptoms last less than a month, and chronic insomnia is when symptoms last at least 3 nights per week for at least 3 months. Anybody suffering from acute or chronic insomnia? Okay, a few. Okay. We're gonna work on that. In a new survey commissioned by the American Academy of Sleep Medicine last year in 2024, 12% of Americans said they had been diagnosed with chronic insomnia. And these are just the people that have been diagnosed. So the occurrence is much, much higher than even that. Insomnia occurs at a higher rate in middle-aged and older adults. And unfortunately, ladies, we're better at men in a lot of things, and also better at getting insomnia. It's more likely, we are more likely than men to develop insomnia. So, what are some causes of insomnia? So, anything stressful, anything that can cause anxiety, work, relationships, murder, etc. And then there's actually a term that I want to mention here. Has anyone heard of the term revenge bedtime procrastination? Very good. Okay, all right. So, for those of you that don't know, revenge bedtime procrastination is when we sacrifice sleep despite knowing the detrimental effects that it has. This often occurs in people who have very demanding or stressful daytime schedules, because it is that time to kind of turn off your brain and get that me time. So that's a common cause of insomnia, and that's not even technically insomnia, because you have the ability to fall asleep, but you yourself aren't going to sleep because of the stressful schedule and making that me time for yourself. But what else? Okay, other than stress, anxiety, poor sleep habits can definitely cause insomnia. Well, what are good sleep habits? Sleeping and waking up at the same time every day, avoiding caffeine later on in the day, eating heavy meals closer to bedtime, working out really intensely at bedtime. A lot of times people think, well, if I just work out really hard, I'll get really tired and then it'll help me go to sleep. But in fact, it does the opposite, because it increases your cortisol, and oftentimes your energy levels, and then can make it a lot more difficult to actually fall asleep. So doing the opposite of any of these things can affect our ability to fall asleep and even stay asleep. Shift work disorder is a big one, and anyone who works a night shift or any shift that would require being awake at normal sleep hours, that can affect our internal clock and cause insomnia. Jet lag, a lot of people have to travel for work, or whatever it may be, or pleasure, but it is tough to get back on a normal sleep schedule if the time zone is a lot different than what you normally have. Medical conditions such as sleep disorders, mental health conditions, all these can cause insomnia, along with even medications. Some even like a common beta blocker. I don't know if some of you are on that, but that can cause insomnia. On the flip side, there's a lot of things, over the counter that people are taking for sleep. I will say, these things can help you fall asleep. I'm talking about maybe like Benadryl, NyQuil. Data has shown that it can help you fall asleep faster, but it does often disrupt your quality of sleep or lower your deep sleep, which leads to more grogginess the following day. And then finally, there are factors such as aging, hormones, environmental factors such as noise, or light that might require you to duct tape your blinds to the window, that could disturb your sleep. So why is this such a problem? And to address that, we've got to address first, why is sleep important? So sleep is much more important, I think, than a lot of people realize. We spend a third of our lives in sleep. It's needed to rid your brain of toxins. It helps restore physical ability. It's vital for strengthening the immune system. If you get less sleep, you're actually more likely to pick up a viral or a bacterial infection compared to someone who's getting adequate sleep. It helps regulate your mood. I'm sure some of you have probably felt this, but fun fact, If you get less sleep, if you're sleep deprived, you are 60% more emotionally reactive. I know I have felt that. Um, and last but not least, sleep is important for memory, information processing, solving a murder, perhaps. And then these are the different stages of sleep. Each stage kind of serves its own role, its own purpose. So this is kind of a depiction here of all the stages of sleep. We've got our REM sleep, and then we have our non-REM sleep. Um, Non-REM sleep is the first part of the cycle. It's made up of the 3 stages. So stage 1 is that transition between being awake and falling asleep, where you're kind of in a light sleep and you can be easily um, woken up. And then after that comes stage 2, which is a deeper stage where your body temperature drops, your breathing and heart rate slow down, and that's when your brain starts to organize memories. And then there's stage 3, which is the deepest sleep stage. I know a lot of people, a lot of social media out there, they're stressing getting REM sleep. But in fact, stage 3 is a very important stage of sleep too. It's where your body and mind heal and recover from stress. It's important for physical recovery and growth, and it's actually considered the most restful stage of sleep. And then you've got your REM sleep, which is your rapid eye movement. And that's when you dream and your eyes move rapidly behind your closed eyelids. And this stage is important for cognitive functions like memory, learning, and emotional processing. And then getting inadequate sleep over time can raise your risk for chronic long-term health problems. In the past 10 or more years, research suggests that sleep loss, so that means for young adults, that would be less than 7 hours per night, has wide-ranging effects on cardiovascular, endocrine, immune, and nervous systems. Basically, every system in your body, you name it, poor sleep will affect that. It could most certainly cause the inability to solve a murder, but it also has been known to cause obesity in adults and children, diabetes, cardiovascular disease and high blood pressure, hypertension, anxiety symptoms, depressed mood, and alcohol use. So then that brings us to the treatment. How do we treat this? The gold standard is actually not pills, not medications. In fact, it is something called cognitive behavioral therapy, and that kind of is a combination of the therapies listed. Cognitive therapy, which is changing attitudes and beliefs that hinder your sleep. Relaxation training, which is relaxing your mind and body. Sleep hygiene training, correcting bad habits that contribute to poor sleep. Sleep restriction, which is actually limiting the time in bed and then gradually increasing. And then stimulus control, which we kind of spoke a little bit about before, going to bed, at the same time, waking up at the same time every day, and also leaving the bed when you're unable to sleep. So really only sleeping when you're in the bed. And then, of course, the over-the-counter medications that I had mentioned before very briefly. Just remember that, yes, they can help you sleep better, but they can affect the stages of your sleep. They can decrease that stage 3 sleep that I had mentioned, that deep restful sleep. And that's why a lot of times you'll realize when you take Benadryl, you knock out, right? And you feel like you had the best night of sleep, but you're more groggy that next day. So even though maybe you fell asleep faster and you got those 7 to 9 hours of sleep, but you didn't get that quality sleep. You didn't get that stage 3 sleep that you really need to feel refreshed. And then finally, there are prescription sleeping pills. In certain cases, it is necessary, but these medications really are meant to be used short term and are not meant to be taking them long term because they can have an addictive potential and can be dangerous. So here's some tips and tricks on how we can prioritize and regulate our sleep cycles. So you could try to create a sleep schedule. So just trying to kind of get into bed around the same time every day, trying to wake up around the same time every day. Now this is Easier said than done, I'm sure, because I know on weekends we often have a social life and can end up sleeping later. There's actually a term for that too, and it's called social jet lag. It happens because our bodies don't really realize that, we're just going out for the weekend. In fact, it's kind of acting as if we traveled to, I don't know, California and came back if we're off by a few hours. And that takes a few days to adjust back to normal. So that social jet lag can cause you to feel really sleepy and can even cause trouble with falling asleep. So trying your hardest to stay on that same sleep and wake cycle can be beneficial. Exercising is really big too. If you can exercise outdoors, I know get sunlight is kind of further down on the list, but getting sunlight, exercising outdoors very much helps regulate our circadian rhythm, which is our internal clock. And getting that during the day can actually help you get sleepy at night. And then avoiding stimulants like caffeine. Caffeine has a half-life of 6 hours. And so what that means is 6 hours after you've had your first cup of coffee, it's half gone. And then the next 6 hours, half of that will be gone. So it takes quite some time for it to fully be out of your system. So that's why it's really important to, if you're having trouble with sleep, stick to caffeine only in the mornings. And then creating a good, sleep environment. So dark, quiet, cool temperatures also. And then finally, try your very best not to get involved with a murder.